Hello and welcome to Inspirational Focus. We're glad you can join us. My name is Craig Klein and I am a deacon in the Episcopal Church. Today we're going to be talking with Dr. Fred Williams. Dr. Williams is the head of Chaplaincy Services at Holzer Hospital in Gallipolis, Ohio, and we will be discussing all things chaplaincy and how one becomes one and the kinds of work that chaplains do. So, Dr. Williams, welcome.
Thank you for having me, Craig.
Appreciate
it's
you being here.
Pleasure to be here today.
Okay.
Look forward to talking to you.
You bet. And I guess I'd like to begin with how does one become a director of chaplaincy services? Is that a career path that one can aspire to?
It is.
Okay.
One can start out with that career path and take certain courses. Most chaplains do come from a religious background with prior service in a church, and so therefore most chaplaincy programs require usually an MDiv or something of that level of education to be a chaplain, a full-time paid chaplain. Of course, there are volunteer chaplains, which we're going to talk about some today.
Okay.
But my path to becoming a chaplain was having other ministries involved in the church, and then making a change of ministry about 10 years ago and finding the job here at Holzer Health System. So I don't know how much of that journey you want to hear about.
That's good so far.
Okay.
Okay, so you mentioned an MDiv. You clearly have a Ph.D.
Right.
What is that in?
My Ph.D. is in New Testament biblical theology, which is a historical theological study of the New Testament and explorations of topics that would come up in that study.
Okay. And where does one go to find such a degree or find such a program? Where did you go?
That's typically a seminary type program, usually in a university type liberal arts setting. But my own path to that was through a small Bible college where I got my bachelor's of theology, and then from that I went to the non-denominational seminary in Greenville, South Carolina, Bob Jones University. And I started out with a master's in church history. I became fascinated with church history while I was in Bible college, and so continued that studies. But when I continued my PhD studies, I decided to change my focus to New Testament biblical theology and biblical languages, as well as continuing church history. Okay.
And so you have considerable education. You clearly have considerable experience. Tell us, please, what exactly is a chaplain?
A chaplain, historically, has been a person from a religious group with religious training that serves in a non-religious setting, typically started out in the military, and then has gradually expanded to prison ministries, university ministries, healthcare ministries, and even broader than that, but that gives you a little taste of how broad it is.
That's true, and I think a lot of people do associate chaplaincy with medical settings of one kind or another. But, for example, as anyone who's watched MASH knows, there was a chaplain who appeared in every single episode, Father Mulcahy. But, of course, chaplaincy can occur in other places, you know, in restricted situations, prisons, jails, that kind of thing. How big is the chaplaincy operation at Holzer?
At Holzer, historically, Holzer has had a directory of chaplaincy services, which I am now and have been for the last 9.5 years, and it has typically had 30 to 35, sometimes 40 volunteer chaplains assisting the director. So I'm the only paid chaplain there. Of course, we have 2 hospitals, a nursing home, and a hospice program that we provide chaplaincy services to. And so the volunteers are a very important part of what we do, and could not make all the visits we make if we did not have 30 to 35 volunteer chaplains.
It's amazing. So I know that when you go into a typical hospital setting, you see everybody is wearing color-coded scrubs or uniforms, and it's a rainbow of colors. Are chaplains also identifiable in that way?
Usually not. The chaplains traditionally wear, sometimes if they're identified with a religious community that has a cleric collar like yourself, they can wear that like you do. Otherwise, they just wear normal, what the hospital would call in its dress code, office attire.
Office attire, okay.
So I would dress either like I am now or in a business casual way is the way we dress at Holzer. We are identified at work. If I was at work, I would have my ID badge on that says chaplain, and my name and picture would be on it.
I see. So that's a reasonably good way, I think, for people to identify a chaplain. I guess, coming down the hall.
Right.
So you have all these chaplains. You certainly have enough there that you could have a different person every day. Seems like in a monthly cycle, I'm guessing?
That's what we try to do. One chaplain serves 1 day a month is how we try to do it.
All right. And everyone, and clearly they make rounds. I can't imagine that they go out randomly selecting rooms to go to. That may be possible.
It used to be possible until HIPAA passed more privacy laws in 2003, and it became even more restrictive for the chaplains. Of course, the hospital can interpret those a little differently, but typically the way we work in most hospitals is the chaplains are given a list of patients that have requested spiritual care through the chaplaincy program, and the nurses screen for that question. And so we get a list out of the patients who are asking for care. And those are usually considered, in a spiritual sense, the most needy and the ones that want to be visited. But we also do what is considered to be the old-style chaplaincy work in some units in the hospital that are considered high need, like the critical care unit. We make rounds in there as chaplains and personally present ourselves available for anybody who wants us. And usually 80% of the time or more, the chaplain is able to make a connection with the patient or family, making rounds, and are able to end up having a ministry there, even though they haven't been requested. And if we have time, we make rounds on the other units and meet people and minister to them.
Well, thank you for that. In the interest of full disclosure, I too am a chaplain at Holzer, and while my questions may be phrased in a more general manner so that we can explore the topic in the discussion, I serve my 1 day a month, as do all the others.
And we appreciate your service, as all the others too. And I might add here, I don't know if you were going to ask me later, Holzer's 35 chaplains come from a diverse group of churches from a 4-county area. So in a way, we are a community hospital, nonprofit, and so having that connection with the chaplains in a 4-county area is one of the ways we are a community hospital. The chaplains represent the community to us, and through the chaplaincy, we represent the Holzer Health System to the community.
I see. Okay. So the people that are there could be, in Christian terms, could be liturgical, they could be charismatic, they could be evangelical.
Yes, we have all of that. And others.
Yes. Very good. All right, so I'm going to dig into this just a little bit more and start with really basic questions. First of all, if we have chaplains, then we must have a chapel at the hospital, and I think we have a slide of that.
Okay, very good. Yes, we do, and that is an excellent picture of what we call the Chapel of the Great Physician. That's its name. That's the main chapel at the Holzer Hospital in Gallipolis, and that one is the smaller chapel that was built in the newer hospital in 2000 in Jackson. So that's the Jackson Chapel, and that one's entitled the Interfaith Chapel. Of course, they're both that, but they just have been given those two names historically. But that stained glass window that you saw at Gallipolis is done by a famous French glass art maker who lived in France, named let's see, what was his first name? That escaped me right now, but Leor is his last name, and he's passed on in 1996. But he was very famous in the stained glass making era, and he built the broadest expanse of stained glass art in a church in West Berlin. Wow,
those are striking credentials. Now, I noticed that both of those shots were facing forward to the front of the room. If we turn the camera around in either of those locations, what would we see?
There's about 5 or 6 rows of pew-type structure in the larger chapel in Gallipolis for people to sit in, with kneeling benches that can pop out just like in a church. It has a concrete wall on one side and a wooden wall on the other. The other chapel, the smaller chapel in Jackson, as you saw, had lavender wainscoting with white paint and lavender walls. And it's got 2 rows. It's much smaller, 2 rows of about 6 seats.
And there it is again.
Facing forward. So, that stained glass window was made by the brother of one of our chaplains who served about 25 years in Jackson. And he does stained glass work, and he dedicated it to our chapel because of her and other people that he knew in the hospital.
Okay. And is it true, in fact, that most hospitals, kind of like airports, do have some kind of a spiritual space of some sort, if not called a chapel?
Most of them do, and most of them do call it a chapel. And they're styled differently. There's a lot of aesthetic appreciation that goes on in chapels, and that's why the stained glass and the lighting and the paint, and even the concrete wall is very Gothic in our chapel in Gallipolis. They all have kind of a religious overtone, symbolizing some kind of inspirational or spiritual thought, like granite would represent strength. The lavender walls and the lightness of the light and the different colors represents love and beauty, all things that we associate with things related to God and meaning making in life.
Thank you. Does it go so far in terms of the organization of how the chapel is used that I'm guessing non-denominational services would be scheduled on some kind of a regular basis?
Not so regular now, used to be, but now it's mostly used for personal meditation and prayer from the patients and staff. We do have a National Day of Prayer service in there. We do have some non-denominational interfaith type memorial services for people who've passed on. And other type, we have a Lenten service in there once a year done by our local Catholic priest. He comes in and does it, but in a sense it's non-denominational because we invite anyone who wants to come, and I know the staff, so a lot of the staff that come are maybe Lutheran and or Presbyterian, so it's kind of done in a Catholic way, but everyone feels welcome.
Good. Thank you for that. And can chaplains be called at times other than when they happen to be there on their shift?
They can be, but I'm the only paid chaplain, so I get the privilege of being the _1 guy to be on 24/7 call.
I see.
But we do advertise that we have 24/7 service, so anytime a chaplain is needed, a call can be made. Anytime I'm officially out of state, out of town, I let the hospital know, and there are, believe it or not, some volunteer chaplains who say, I'll fill in, even for an emergency call off hours.
Okay, so that's wonderful. I'm glad that there's that spirit of assisting and professional camaraderie exists. It sounds useful.
It is.
And so I think a question many people might like to know is how's a chaplain trained?
At Holzer in the volunteer system?
Yes.
Well, they go through a screening process, of course, and Holzer is a hospital and is concerned with privacy and public safety. So as a chaplain, you will have to have a background check. You'll have to go through the volunteer training program, drug screening, TB test, flu shots, all the things that any healthcare employee would go through. And then once that's done, we look at your ministerial training and practice and get 3 letters of reference, and we interview you, and we really try to make, mainly me, try to make a determination if you're a sensitive type person that can function in the sensitive world of multi-faith people who you're going to be encountering and minister to them in a broad public way without thinking they're going to be your future church member. So there's no goals.
No proselytizing.
No, no, that's not consistent with what we do.
Okay. I'd like to remind you that you're watching Inspirational Focus. I'm Craig Klein, a deacon in the Episcopal Church, and my guest today is Dr. Fred Williams, who's the Director of Chaplaincy Services at Holzer Medical System?
Holzer Health System.
Holzer Health System.
Holzer Health System.
And we are obviously discussing what chaplains are, what they do, how they get to do what they do. And the discussion would naturally lead at this point to services, I guess would be a term, that chaplains can provide. And we have a list. I think we have a trifold that we put into a slide. Let's see if we can have that up. There we go.
Okay.
So we're going to start, we're looking on the left-hand side of the screen as you're looking at it now. And I see you at the bottom, at bedside, which is a typical place to be.
That's a typical chaplain pose.
There it is. So we're going to go straight down the list here.
Okay.
We've talked probably a fair amount at this point about patient visitation.
We have.
Okay. And is providing prayer something that is offered, and if so, is it requested or is permission sought?
It's open to the chaplain to make a judgment call, and depending on how much training they've had with me and how much other training they get, our chaplains do get some extra training once a year, and they're invited to go to other seminars that I have access to if they want to go. But the issue of prayer, on the first thing, prayer is probably the most common response that a patient is looking for, regardless of religious tradition or anything. Because it's pretty common in all faith groups to pray to your deity. That's where the source comes from. So it is very common. But chaplains are trained to not to assume that any patient wants anything, to always listen to what the patient says and try to ascertain what they want. So at all times, a prayer is not needed. Many chaplains share with me as volunteer chaplains who sort of as ministers have a default response to need to pray for it. They will say, we had a great visit and I thought I was going to get to pray at the end, and I asked them if I could pray and they said, no, don't need a prayer. So they've learned, I think, and I have learned as well, to not to assume just because someone may be religious and expressing need that they want a prayer. And that would lead me to say also that sometimes a chaplain listening and interacting with the patient and making comments sometimes serves as the prayer. It's interpreted as the prayer of the chaplain taking the need of the patient to God, because of all people in the hospital, the chaplains symbolize relationships to God, whether it's spoken or not.
And along these same lines, it's my understanding that hospital laws of privacy prevent hospitalized patients to be announced in the newspaper.
That's correct.
That's correct. So some churches who visit the sick, or some clergy, sick in a chaplain capacity or otherwise, may not know the patient's actually there. Any thoughts on that?
Well, that's addressed in our brochure, actually, but yes, I do have some thoughts. There are hospital policies in our hospital, and I think most others, especially since the HIPAA rules came out, which control that, is that if someone comes to the hospital to visit someone, in order to find them, you must have their first and last name. And you must ask for them by their first and last name at the reception desk. At that point, we are permitted to tell them the room number. Our volunteer chaplains, nor any visiting minister, is not allowed to just come in the hospital and walk the halls and go from room to room. That's a violation of that patient's privacy. So we don't do that anymore. But if you come to the hospital as a minister looking for a patient and you have their first and last name, we assume you've been told about them, the minister has been told, and they are seeking them. A minister can't just come in and say, I'd like to visit all the Presbyterian patients or all the Baptist patients and get a list of those names. We don't do that.
It doesn't
anymore.
work like that at all.
No, not anymore.
Okay, seems reasonable. It did.
Yeah, it was reasonable for a while.
Okay. Getting down a little bit more to the heart of the matter, spiritual care and pastoral counseling. First of all, let's have a definition of spiritual care. Spiritual care
focuses and tries to help a patient deal with the larger issues of life that are transcendent, like helping a patient find meaning or maintain meaning in relationship to their thoughts about what life is all about, and maybe questions like, why is this happening to me? And their thoughts about what might happen if they don't make it. And those are things that come to people's minds when they enter the hospital, even if they're not very sick, because everyone has that scenario in the back of their mind that they knew somebody that went in that wasn't very sick, and all of a sudden everything went south and they didn't get out.
I see.
So anxiety is a common problem in the hospital. It's just life.
It is. It is.
Yes.
And I think part of the process of being human.
Yeah. So spiritual care is paying attention to that patient's spiritual sensitivities and how they're functioning emotionally, how they're coping with their illness, and any issues it may bring up. And they typically bring up issues like self-acceptance, guilt over life choices, and things like that. And it's amazing how quickly a patient is willing to trust a chaplain who's understood to be bound by privacy laws not to repeat anything.
That's right.
How quickly a lot of patients will pour out their life story, including what they determine are their mistakes and sins, and confess them to the chaplain, and they take them to God, and it's very helpful to them.
I can imagine it would be. It'd be unburdening oneself.
It is.
Okay. So can we see the slide again with the brochure on it? So you see spiritual care and pastoral counseling. What does it mean to be pastoral?
Pastoral would probably focus more on leading a person along in life choices, probably and many times related to their own religion. Sometimes the chaplains, in broad terms, like the Judeo-Christian traditions, are very common in a lot of different churches. And a patient might start using you in a pastoral manner as their pastor briefly for 10 minutes.
Okay.
And it kind of transcends into or transforms into them looking to you to meet their needs, maybe with a more religious context than the broader spiritual care that you would provide.
Okay, that's very good. I've put some things in context for me as well. I also see practical counseling on here.
Practical counseling is just trying to deal with the ins and outs of life, maybe the policies of the hospital that the patient may not know about, like who would I talk to find out about this, or you know, can I talk to the doctor again? You know what's going to happen next. Like a lot of times when people die, a lot of the families don't know what happens next. They don't know that they need to give the hospital the funeral home name, things like that.
So you can be kind of a helpful connective kind of role.
Right. Like, what do I do now? Can I stay in the room a while? They become almost not knowing what to do. And so we just give practical advice based on hospital policy and our knowledge of the personnel and the typical way things happen in the hospital. Like a lot of patients say, I don't know how I'm getting home. And I said, oh, we have social workers that deal with that.
Okay.
We'll get one to you.
We'll find someone for you.
We'll find someone.
So can the questions go down to a kind of granular level, like I came in here with glasses and a watch?
Absolutely. I've gone to Lost and Found many times trying to help patients find things they said they brought in. Many times they're mistaken. Their loved ones took it and kept it for them.
How about bringing service animals in?
That is allowed.
It is?
Yes. And we like to know about it, although I had one family sneak one in a big purse, little chihuahua, and I made sure that was okay.
Okay.
So
good.
Since I knew it was okay.
Okay. Does this extend to so-called comfort animals?
It probably would, but we really have very few requests for that.
Okay.
But I do know that we've had requests, and I've checked on it, and it is permissible most of the time.
Okay.
We make sure things are going to be okay, but most of those service pets and comfort animals, they usually are not a problem. They're called that appropriately because they are. They're usually very well behaved.
And they're usually easily identified by the vest that they all wear.
Yes, and even some of them, the comfort pets, they don't wear anything, and they're not really identified and trained. They're just good pets. The patients miss them and they need them. And the one that I helped get in there in the purse was for a dying cancer patient, and that's what she kept talking about. And wanted to know if she could bring it in, and I said, well, you have your loved ones bring it in and you take care of it, and they usually do. They take good care of them because they loved them, and we've never had a problem with that, but it's happened not very often.
Okay. Yeah. Well, it's just something interesting that comes along. In my experience, I can't recall ever seeing a service animal in a hospital room, but it seemed entirely possible that it could happen.
It's going to happen in your experience, I'd say, because it's getting more popular.
So I see.
Yeah.
Let's go to another area. Have the brochure back up again, please. Okay, we're at crisis intervention and grief counseling.
Well, crisis intervention is a broad term that we use just to refer to anything that's brought on a sudden emotional or spiritual crisis for a person. And that usually would be typically a diagnosis of cancer when the family or patient did not expect it, or the approaching death. Someone has clearly been told by the doctor that they are not going to make it and death is imminent, and the family is not ready for it and they fall apart, and a sort of an emotional crisis comes. And that's typically when a chaplain is called, and we're usually the last one into the situation, and we come in knowing nothing and knowing no one in the family, and that's when a chaplain really has to exercise his sensitivity and step up and be there and be a presence. And the grief counseling, therefore, in those situations, even if it's just a cancer diagnosis and they have not yet been told that death is imminent, the word cancer brings in grief feelings and the fear of death, and all that anticipatory grief, as we call it, starts operating. And so we try to deal with crisis and those feelings in that setting, and so that's kind of what we call that, because it's a very particular, special, focused chaplain work.
Okay. So it strikes me that a kind of grief could be loneliness.
Yes.
And is part of the role of a chaplain, if they sense that someone is dealing with overwhelming grief, to try to find a clinician of some sort, a counselor, a psychologist, anything like that?
We do make psychiatric referrals. We have a psychiatric unit, but it sounds like the kind of description you gave, that would be a typical case of a chaplain being called.
There you go. Okay.
I'm frequently called to patients who amazingly do not have family. They have no friends. They say they're lonely. They have no one to come and see them. Sometimes it's approaching death and they have no one. And I'm frequently called to visit and sit with them. One time I was called by a family member away from a person here who had no one here, and their family member was several states away. They said, would you sit with my loved one who's already died just for my comfort and theirs, knowing that you're there?
Okay.
And without getting into the discussion whether or not people who've died have any sense of presence of a chaplain, I said, of course I will.
Okay.
So,
very good. That's very enlightening and gives a true sense of some of the more challenging situations a chaplain might find themselves in. Let's take one more look here at the brochure. Okay. Last thing on our list on the left-hand column, an advance directive. In advance of what and directing people to do what?
It's a legal paper where a person states what they do, or more specifically, what kind of care they do not want, where they can assert their medical rights to say, and legal rights to say, I do not want any extreme end-of-life sustenance care given as I approach death. I want my passing to be natural, and I want to be kept comfortable. That's the specific result of an advance directive, where the sick person says in advance that they do not want life-sustaining treatment when they're about to die. It's very important for the family to know that, very important for the doctors. If you could get those papers in place before you get sick, it's much easier to handle emotionally when it happens for the family and the patient. Now, that typically is only done by myself as a trained chaplain or other hospital personnel who are trained to do advance directives. The volunteer chaplains do not do that part of the care. But that does bring up that I also serve on the ethics committee as the co-chair of the ethics committee. So if there are questions about care, especially end-of-life care, or controversies within the family about whether or not to withdraw care at a certain time, the chaplain is represented on the ethics committee to discuss and try to bring resolution and agreement on that patient care plan.
Very good. Appreciate that level of detail, and on particularly something as important as an advance directive. I'd like to thank everyone for joining us today. We are out of time. Okay, this is Inspirational Focus. I am Craig Klein, deacon in the Episcopal Church. My guest has been Dr. Fred Williams, the Director of Chaplaincy Services for the Holzer Health System.
Thank you for
sir.
having me.
Take care.